let's talk a little bit about insurance, okay? It's a kind of a scary big world if you're trying to look for insurance, but in January, that's when most of the insurance policies start again. One of the most important things I want everybody to know, okay? There's something that's called an HMO, and there's something that's called a PPO. This you have to go to one specific group. All of the doctors have to be in plan with this. With an HMO, the premiums are usually less because it's all one system, but you do not have the ability to go outside of that network. So people will be like, oh, I have Blue Shield HMO, but I don't take Blue Shield HMO. The main reason is that the reimbursements to the doctors are less. That allows the patients to have a lower premium. It's a really good system, like Kaiser's an HMO. It's all in one system. So you go to this doctor, boom, kidney doctor, boom, 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 pulls up your records. Oh, I gotta go to the heart doctor, boom, boom, boom. You get both, you get all the records in one system. HMO is great for the specific people. If you desire to have more options, let's say you want to go to your dermatologist over here, you want to go over here and check your knee, over here you want to get something done. PPO is a preferred provider organization, and that one you can go to anybody outside of the network that takes your insurance, okay? So this allows more ability to go multiple places. This one you have to go to the doctors that are with that. Premiums often less with an HMO. PPO, a little higher premiums. They both have great options. Just know, if you have established doctors right now and you're looking to switch, you better find out if they're in your HMO network, okay? Those are just important things. Don't grab a policy that you're like, oh my God, I'm stuck with this. You can only change usually once a year. The next factor that everybody needs to know about is deductibles, okay? A deductible is an amount of money the insurance company wants you to pay before they'll cover any of your services, okay? Deductibles can range from $0 up to $2,500. So let's say you have a $0 deductible. You're going to have your premium is going to cost more each month, okay? More money per month, okay? If you have like a $2,500 deductible, your premium is going to be less because your insurance is going to be like, pay this first. If you're a person who doesn't go to the doctor very often or doesn't really have any major medical issues, it's okay to get a premium with a high deductible because often the high deductible policies don't cost too much a month, but they usually cover your yearly checkup, they usually cover your mammogram, and everything that your one-time year checkup that both men and women should do. If you are a person who has a lot of medical issues and you know you're going to be going to the doctor a lot, you may want to find a policy with a lower deductible, because that means if I want to see a doctor and I have a $2,500 deductible, I'm going to have to pay $2,500 out of my pocket before anything's covered, okay? So check those two things out. Another thing, there is a copay. A copay, that's an amount of money that you pay per visit to any provider. For example, for our patients when they come for PT, chiro, they may have a copay that's anywhere from $25 to a visit up to $45, sometimes it's $0. So these are things you need to know about. Deductible, pay less per month, but you have a high deductible. If you want no deductible, you'll pay more per month. So kind of look at your medical needs. When you're looking at a plan, make sure it covers your yearly checkup. And men and women, you got to get your yearly checkup. Don't be going 2-3 years without a mammogram. Like, I've had people don't go 2 or 3 years without a mammogram. Men at 40 up, get your prostate checked, okay? Don't be messing around. Don't be thinking you're like a tough man. You can't get that checked. That's super important. I had a patient, he's 60. We found him with the man with the cancer. And he's in a whole world that's not a health world, but he's like, no one told me to get that checked. I would have got that checked. But for myself as a doctor, as a person who's experienced, like, how does somebody not know that? But people don't know, so they can often do it by a blood test this time of year. Medical stuff's moved up, so go with a yearly, get it checked up, make sure your plan covers it. And that's a little bit about insurance. If you have any questions about insurance, feel free to hit me up, send me a message, I'll guide you the right way. I think as an individual these days, not a company insurance, the only plans that are for individuals are Blue Shield. You can go right on to Blue Shield of California, you can look in your area, and they can give you your plans. So hit me up, you got any questions? That's super key. It usually starts again in January, and insurance is key.